So the WAF is an essential Schulfried product. We mainly developed the WAF for the area of neuropsychology, and as you might know, the assessment of attention is a central part of almost all neuropsychological investigations, mainly because in most neurological or psychiatric disorders there are deficits in attention present. So especially digital tests enable a differentiated and precise assessment of attention. This is mainly because when using computers, we're able to measure on a very precise scale, for example, when we're measuring reaction times. We didn't develop the WAF on our own. We worked together with a renowned cooperation partner, the test author of the WAF, Walter Sturm, who is an expert in the field of attentional disorders and their diagnosis. He published, for example, books in the field of clinical neuropsychology or attentional disorders. He even worked on the guidelines for the assessment and therapy of attentional disorders. And he published a lot of best-selling books and top-tier journals like Frontiers in Human Neuroscience and PLOS ONE. So when we talk about attention, what are we actually talking about? So attention can be subdivided into different dimensions, which you see right here on the left. We can have a look at the intensity of dimension, at the spatial attention, and at the selectivity of attention. When we look at the intensity of attention, we can measure in the area of the attention activation, which we call alertness. Here we often have simple visual or auditory reaction tasks without a cue. This would be called tonic or intrinsic alertness, or with a cue, which would be called phasic alertness. Of course, we can also have a look at the sustained attention. So here we are looking at similar simple signal detection tasks, but we have them over a longer period of time. And in sustained attention, there's a high proportion of relevant stimuli where you have to react. In Vigilance, the tasks are pretty similar. There are also simple signal detection tasks over a longer period of time, but here we have a low proportion of relevant stimuli where you have to react. When we want to measure visual spatial attention, we often have tasks where a shift of attention from one spatial focus to another is required. When looking at the selectivity of attention, we can either measure selective or focused attention. Here we mainly have choice reaction tasks with or without distractor stimuli. Or we can measure the divided attention. Here we often have different kinds of information channels, like the auditory channel and the visual channel. And here the attention is required to be divided between these information channels. So when we took a look at the guidelines for the assessment of attentional disorders, which I talked earlier about, there are some recommendations how to actually assess attentional disorders. And here we have listed the essential aspects. So in case that an attentional disorder is being suspected, each investigation should at least include one method to assess the intensity of attention, like alertness, and the selectivity of attention, like divided attention or focused attention. And also, if we know there are some right hemispheric, especially parietal damages, then we should always take a look at the spatial attention. So far, so good. Now let's take a look at the new WAF. We're going to talk about the WAF as a comprehensive package, what has changed in comparison to the WAF we had before. Then we're going to see what kind of standard templates we have with the WAF, how to use them. We're going to see that we revised the instructions to make them easier to understand. We have 2 new subtests I want to talk about. I'm going to show you the latest updated norms and few new innovative scoring options. And the new WAF, of course, is touchscreen compatible. So, as you might know, before we had a lot of different WAF tests. We had the WAF A for alertness, the WAF G for divided attention, and so on. So now the new WAF is an all-in-one package for the assessment of attention. We took all these 42 different subtests from the old WAFs and we made it into one big test. So the whole spectrum of attention is available in one test now. And of course, you have a maximum flexibility in the selection of dimensions. The old subtests didn't disappear. There are in the new WAF, and we actually have 2 new subtests. So now we see the VTS right here, and I want to show you how to use the new WAF. As you can see in the middle of the screen, we have some templates for particular diagnostic questions. For example, if you want to test for ADHD, dementia, or schizophrenia, we have some valid templates for this, but of course you can also have your own combination of subtest sequences with the help of the so-called WAF wizard, which we see right here. Here on the left side you can see all the different dimensions. You can choose the subtest, you see long forms and short forms, you see the duration of each subtest. There's also a description of dimensions. For example, if you're not so sure what again was the difference between vigilance and sustained attention. Here you can add the subtests into the sequence. Of course, you can also change the order of the subtests right here. You can insert the breaks flexibly, and you can define the form of instruction and input mode. Supervisor supported testing is possible in the WAF as well, and you're able to do it with mouse, with response panel, or even with touchscreen. After you have selected your own subtest sequence, you can add them to the current sequence or save it as an own subtest selection. So later on you can go back and reuse the same subtest sequence you just created. When you save the subtest sequence, you see it right here, say under your My Subtest selection. So we haven't just put all the WAF tests into one big test, but we also listen to the feedback of our customers. One thing we heard a lot was that the WAF instructions, especially for complicated tests like for divided attention, were a bit hard to understand, especially for severely impaired patients. So now we revised the instructions. They are now easier to understand, and of course supervisor supported testing is possible, so you can also explain the instructions yourself to the patient or client. And we have a more stepwise instruction with animations. There's less text. There's always an example where the client can see what's the task. Then there's also a possibility to rehearse the task in a training phase, and every complicated task like for divided attention gets explained step by step. So we also, like I said, added 2 new subtests. The first one is visual scanning, which you can see on the left. And visual scanning is measured by a series of items in which the client must search a 6x6 matrix of similar visual stimuli, which you see right here. And as a client, you must decide for every item whether a previously defined relevant stimulus exists or not. Then the second new test is the smooth pursued eye movements subtest. And here the client tracks his eye. It tracks a circle with his eyes, of course, which you see on the right side right here. And this circle is moving across the screen, and the client should not move his head during this task and should react as quickly as possible when the circle becomes brighter. So these are our new subtests. And now let's have a quick look at the updated norms for our subtests. We collected them in 2016, 2017. There are around 300 people in this norm sample between 17 and 88 years old. And the special aspect right here is that all WAF subtests were conducted by each test person during norming to have a higher accuracy for the scoring. So now let's actually look at the scoring, and we have done a lot here. It's a leap in innovation, I would say. One big thing we have right here are the dimension-specific indices, where we have an overall score for the attention performance and also scores for the dimensions like alertness or divided attention. And these are based on the structural equation modeling, which we conducted during the constructor validation. So We also have something new called norm adjustment, and this is from a psychometric perspective speaking pretty revolutionary as well, because here the influence of age, gender and or level of education can automatically be taken into account for the scoring. So these are not classical norms where you have like different age groups which are subdivided in a discrete way, but here we have a regression based alternative. So the scoring can account for the impact of multiple covariates simultaneously, and we have greater accuracy because we don't have these different groups for the norms, but we have a big sample which uses this linear regression based approach. So another new thing is that we can now display and evaluate follow-up assessments, as you can see on the left side and also on the right side. The results from the primary testing and follow-up testing can be presented in the same table, and we also have an evaluation if there's a significant change between the results from both testing times. For the new subtests, we also have new scoring elements, like here seen for the visual field protocol or for the smooth pursued eye movements, where we can take a very deep and detailed look into the results. And as I said before, all subtests can be even performed via touchscreen, and supervisor-supported testing is possible. And we have a high technical precision through the application of a calibration device. Alright, you can see the calibration device, and now let's summarize all of this. The WAF enables a differentiated and precise assessment of attentional functions. It's conform with theoretical models and guidelines concerning the assessment of attention and attentional disorders. The new WAF is a comprehensive and complete package. We have new, easy to understand instructions. We have 2 new subtests for visual scanning and smooth pursued eye movements. We updated the norms, have very new innovative scoring options like the dimension-specific indices, the norm adjustment, and the display and evaluation of follow-up assessment, and the test conduction is possible via touchscreen. So this was all from my side. If there are any questions, of course, you can write us an email or have a look at our website. Thank you very much for your attention. I wish you a pleasant day.